Hello there to all the viewers. My name is Kelly Canoza. I'm a YouTuber and a social media influencer. Since then, I want to enhance my nose, and I went searching for a solution online. Of course, we have different social media platforms such as YouTube and Instagram. And that is the moment where I saw CSA Derm Center and the Instagram handle of Dr. Contessa. So I inquired and consulted about my concern, and right now I'm here na po. So guys, I have never been this excited in my life. Please do stand by and watch out for the result of my procedure.
Good day everyone, welcome to the CSA Certified Skin Authority. I'm Dr. Contessa, your certified aesthetic physician here at the CSA Medical Aesthetics. In today's episode, we'll have another non-surgical nose contouring procedure. We will be using a different kind of dermal filler, okay? And we have with us today a new guest, and let's all welcome Miss Kelly.
Hi guys!
Hi Kelly.
Hello po.
Welcome to the Certified Skin Authority. So Kelly, could you tell something about yourself?
So I do vlogging and I'm a social media influencer, but I'm currently taking dance, singing, and acting workshops.
Okay, so I think with Kelly, it's very important to have a well-contoured face and of course natural looking, okay? And also, she's into doing makeup on the face, especially the center part, the nose area. And she's doing a lot of nose contouring makeup, right?
Yes.
The thing is, because on the camera, on the screen, we should look like we have this pointy nose, especially ladies. And when we're taking some photos, selfie photos, you're looking at the right angle, you wanted your nose to look sharp or really high nose. Correct, Kelly?
Yes.
Yeah. And nowadays, I think it's really very significant for girls like us, okay, to have this ideal shape of the nose. What's your idea ba regarding the ideal nose, Kelly, right now?
Right now,
Because
parang
we
high.
look at, yeah, you're in the social media.
Yes.
Right,
As a
yan.
beauty vlogger, of course, I need to look presentable in front of the camera and as well as in personal. So it's
Right.
really important for my nose to look more pointy and
Yeah.
the bridge would be more high.
Right. Take note the nose, focal point, the center point. Okay, big impact on the total face, beauty of the face. That's why here at CSA, whenever we do nose enhancement, after the procedure, there's really that wow effect after we have done the nose procedure, particularly the non-surgical procedure that we do here. Okay. And Kelly here would want to try this technique that we do, the non-surgical way. The thing is, she also don't want to have a long downtime. Okay, mahabang pahinga,
Yes.
mahabang recovery. And we have procedures na we call lunchtime treatment or
Wow,
coffee
okay.
break treatment. Ilang minutes lang, and then you'll achieve na a very good looking or sharp nose, pointy nose, and also natural looking nose. What's important here is you still want to look very natural. Not so too much, not so the very drastic, like obvious that you
Obvious
did a
change.
nose job. And it's like just when you're doing your nose contour makeup, you just
Yes.
wanted to improve the shape, the height of the nose, right? And
Yes.
looking at Kelly, how young are you, by the way?
I'm 22 years old.
Oh, she's very young. Okay. I think we have done procedures. Some people are asking, is it safe for teenagers? The youngest I did was 12 years old
Wow.
for dermal filler in the nose. Okay, with the consent of the parent, of course. So I thought she's just a teenager. She's so baby. She's so young looking. Okay. Looking at her nose. Okay. At the radix part, kasi we needed to project it forward pa. We need to make the radix definition here. Because when you're doing your nose line, nose contour here, right, you give that like simulation of having a sharp or high bridge of the nose. So at this part, we wanted to project it, elevate it, lift it, this part here. Okay? Kasi you look like a Chinese, you look like a Korean also, right? Oh. So this one, the nasofrontal angle, ideally around 130 degrees for women, okay? Now, actually, she has this lidocaine cream here. The purpose is to numb the tip of the nose, okay? But looking at the nose tip, it's rounded, typical Filipino, typical Asian nose, Filipino nose, that we have a rounded tip and a little bit lowered, okay, or downturned, especially Asian or Filipino nose, okay? So, downturned yung tip. And for ladies, ideally, the nasolabial angle should be like 100 or 105 degrees or starting from 90 degrees, okay? And then, this one, the sides of the nose, we tend to have alar flaring or wide flaring of the nose, especially Asian nose, okay? Are you pure Filipino?
Yes, I'm
Okay, I thought she's half Chinese, half Filipino. Oh, yan. So what we're going to do right now is the non-surgical way again of nose enhancement. We'll help Kelly here achieve that dream that she would want to have, okay? But of course, still kind of scared of the like the cutting, the surgery, right?
Yes.
Because some people
I'm
don't
so
want to go
scared
through the
of that.
knife. Yeah. Some people are afraid of the surgical way. So she would want to try this non-surgical nose contouring. Do you have any questions before we start the procedure?
No, I don't have.
Okay. Because other people are asking me about the pain or the discomfort. Like right now, we have this topical lidocaine cream. It will numb the skin, okay? Then after a while, we'll still further numb it with some lidocaine injection. Okay, I'm so excited to show them the procedure.
I'm super excited.
Okay, so we'll be demonstrating you the non-surgical nose lifting using a dermal filler when CSA returns. Back mga ka-CSA. So we will now present you the non-surgical nose lifting using the RADIESSE dermal filler. Okay, so this is a biocompatible, biodegradable type of a filler made up of calcium hydroxyl apatite. Okay, so this will be the one that we will be using for the non-surgical nose enhancement of Kelly. Okay, so this is a product of MERS Aesthetics, and MERS is a company from Germany. Okay, so Germany yung ating manufacturer. Okay, so again, actually, I already had presented the RADIESSE dermal filler in some of our videos, and this has been US FDA approved, okay, for procedures, non-surgical procedures on the face. Okay, so we'll be using the RADIESSE for the nose enhancement. Okay, ready na si Kelly?
Yes.
Okay, so a while ago, we had the topical lidocaine cream to numb the tip of the nose. And then, we'll also be injecting a little bit of the lidocaine injectable, the liquid one, to further numb the tip of the nose. So we'll be using this as our point of entry. Okay, so ready na, Kelly? Okay, good. So pinching the tip, and then I have my lidocaine injectable. Okay, injecting tip area. Okay. And then just a small amount of our lidocaine, 2% lidocaine with epinephrine. Okay, so I'll be making an entry point. Ideally, the entry point is infra-tip. Okay. So I have now with me my skewed to the right side. Diba, Kelly? That's why when you're doing your nose contour makeup, it's like having this bulge on that right side. So, I can already check on the nose line. Okay, so I need to correct that minimal deviation or minimal skewed like radix of the nose. Okay, I'll need the radius again. Okay, I have done the nose filler using my radius. So we'll continue when CSA returns. Back mga ka-CSA, we are now going to show you the result of our radius nose injection. Okay, so Kelly, ito na po siya. Okay, so we did injection of our radius dermal filler. We use about 1.3. So dito sa may bridge niya, I use about 0.7 ml, and then dito sa may tip, up to the anterior nasal spine and the entire columella, we use about 0.6 ml of our radius. The reason is, I have to really make her tip look pointy to make the sides narrow or parang slim po yung side ng ilong niya. And I had to do a contour ng kanyang nose, and Kelly had this distinct na medyo may bulge dito, right side, right?
Yes,
so
right
whenever
side.
she's doing her makeup also, her own contouring makeup sa nose, she has also a difficulty of making it really balance yung kanyang pagkaka-nose contour. So actually, when I was doing her radius nose, there was quite a challenge also because of that bulge, this bony part sa kanyang side ng nose, yung right side niya. Same thing, I also have the same problem na I have this not straight nose, so skewed a little bit. And same thing with Kelly, we had the same problem. So I'll be showing to Kelly yung pagkaka-nose filler niya using our radius. Actually, Kelly is a bleeder, so she has a tendency to bleed. And then pag bleeder, usually we have cases of bleeder po, they tend to swell. Mas nagsiswell po sila. Mga previous video po namin, you've noticed our other patients, hindi naman masyadong bleeder. They don't swell agad. But then Kelly had already some swelling. But this is very temporary po. A few days lang, wala na rin siya. We're just gonna do ice compress. So I'll show Kelly yung nose na natin right now. So here's the mirror. I'll give it to you na. Yan. Okay. So the goal again, Kelly, was to define your radix. The radix yung dito po sa root of the nose, pinaka upper part of the nose. And then we wanted to project it and really fill in. Kailangan ko mag-fill in dun sa bridge ni Kelly dito sa radix part. And the thing kanina, while I was doing it, I was trying to balance yung kanyang spur or yung dito niya, yung bulge, yung rinion part, I have to balance dun sa kanyang left side. So I had to add dun sa side na there's like a no laman or no tissue. So I had to make it equal. Kailangan kasi equal yon when you do your contouring. Actually, it's already good. It's a good feeling in, but I can already see some swelling sa kanya.
Yes.
She tends to swell. She
I
has
do
a,
swell
yes, she has a
too
history of
fast.
that. But then few days lang, it's gonna be perfect and well contoured. Probably we will take photos after a week. We will also show you yung after a week result na ni Kelly. And I really love the result sa kanyang tip. Yeah, yung tip niya naging pointy. So perfect yung tip niya. Yes. Kanina it was really rounded or bulbous tip, and then wide yung kanyang side. So right now, with the technique that I did, the injection towards the anterior nasal spine, we were able to project the nasal tip forward and nahila yung sa sides. So because of that, naging pointy yung kanyang tip. So right now, we will be doing ice compress for Kelly, and we'll be prescribing her mga medicines for the swelling. And actually, we also will need to give you antibacterial as prophylaxis lang. And you have to really do for the first 24 hours ice compress and really avoid muna strenuous activities, heavy exercise, especially you swell, you really
Yes, super.
have a tendency to swell.
Wow.
Okay, no heavy or strenuous activities. And when you sleep, huwag mo nang nakadapa. Okay, so kailangan lang straight lang.
Yes.
And then, in terms of what to eat, what to avoid, of course, malalansa, bawal. So, hypoallergenic diet lang tayo. So, would you wanna share something to our televiewers?
Yes.
Yan.
Hi guys! So, this is just a temporary pero super duper love ko po yung result, especially dito sa part ng
Yeah,
baba.
the tip.
The tip of the nose. And honestly, I did not feel anything a while ago. As in completely, I felt too comfortable. Parang they were just like massaging my nose lang.
Right.
And yes, I'm a bleeder. I already told Doktora, and I do swell too fast. As in kahit konting pitch lang, nagsaswell agad yung nose ko. And how much more with that kind
surgical.
of... Yes.
Right.
But
this
all
time,
in all, I'm really happy po. Super.
Yeah, don't worry, that swelling dito sa radix is very temporary. So actually, we'll show them yung mga pictures. Siguro mga 3 days, 7 days, yan. And the good thing is, she mentioned about yung comfort. The Radies right now, they had incorporated na yung lidocaine. So they gave like this enhanced comfort for our clients receiving these injectables. So they're improving our materials, our products. They're giving the best for all of us. And of course, kami na practitioners of aesthetics, we are also always doing our very best to improve our techniques to deliver you best results. Right now po, I think you can see in the televisions or mga reports or news about nose injections having complications or problems like yung tissue necrosis or others hearing of reports ng filler blindness. Okay, yung mga complications can happen if your injector is not well trained or doesn't know anatomy of the face or does not have any idea about the products that we inject. Hindi lang po ito basta-basta nag-i-inject sa mukha. It has to be done by your licensed physicians, aesthetic physicians who were well trained to do this. We've done a lot of trainings, years of training. We perfect our skills, we perfect our knowledge, we master everything, we master the anatomy. And of course, we safeguard everyone from any dangers from what procedures we receive. Okay? So, importante po sa amin yung do no harm. Safety is very important. The good thing, our product Radies had been tested and scientifically, clinically proven to be very safe. Our FDA had approved it. International, European, and USA FDA, they approved the materials. So, safety is important. Okay, kasi others are hearing of yung mga adverse effects, side effects, complications from these injections. Make sure that your injector is a licensed physician, well-trained. Yun lang po. Okay? Para walang scare. Okay. And Kelly kasi had already an experience of injection sa nose, hyaluronic filler naman po. That was in the past. So right now, we use yung Radies calcium hydroxyl apatite. The difference of this one, actually this is categorized as semi-permanent filler. Mas longer lasting compared with the hyaluronic. This one, they did a study that it can even reach up to 3 years. Although in our record, they documented up to 18 months, but there were cases that it can reach more than 2 years po because of its biostimulation effect. Magbi-build up siya ng natural tissue inside. Your own connective tissues will develop inside the nose tissue. So it's like a combination of a hyaluronic filler and the PDO-PCL threads. Meron kasi siyang stimulation of tissue formation. So meron na siyang filler, may lifting na siya, and contouring. And very safe product po. Ayan, Kelly, thank you so much.
Thank you
for
super happy.
gracing our episode today. Actually, you're in this Radies injection for nose. You were the first one that we have demonstrated. But we've been doing this. We have already several patients na ginawa na namin ng Radies nose. Okay, so this is a good one for you. Yeah, dream come true na ni Kelly.
Super.
Actually, matagal na po niya ako minamessage.
Yeah, super.
So, ngayon, ayan na. Wish granted na.
Thank you.
Okay, thank you, Kelly. Thank you so much to all of you. Kayo po na may mga katanungan, you may email us at our email address, csaskinclinic@yahoo.com, Instagram, CSA Dermcentre, FB page, CSA Dermcentre. Our clinic is located here at the second floor of the Pure Gold Dau building, Dau MacArthur Highway, Mabalacat, Pampanga. Contact number 045-331-1117 or 0933-860-9193. Yan. Thank you so much. God bless you all. Abangan niyo pa po ang marami naming mga videos. Just click sa YouTube, Contessa Salvador. Marami pa pong mga bagong episodes na aming ipe-prepare for all of you. So when it comes to natural beauty, you can trust the CSA Certified Skin Authority.